Hello, I am Mandy, and I'm going to be doing a book presentation over Good Kings, Bad Kings by Susan Nussbaum. So let's get started. So, the vulnerable population that I noticed in this book, most of the characters were young adult and adolescent lower class individuals, and they all were mentally and physically handicapped. Some health disparities that they all faced. Um, would be have to be a poor diet. This usually just comes from the lower to middle class not being able to afford healthy foods. In the US, we all know that healthy foods here in the US cost way more than typically the unhealthy foods, the refrigerated foods, the processed foods. So then a poor diet leads to obesity, and with obesity, we know that there are multiple health problems that come from all of that extra weight. Um, Untreated hypertension, lack of access to proper hygiene, untreated undiagnosed diabetes, smoking, alcohol abuse, increased suicide attempts, sexually transmitted infections and diseases. Um, the smoking and the alcohol abuse, I just wanted to point out that a lot of lower class go to these things to kind of distract themselves or to take away from all the problems that they face from, whether it be financial or health problems that they're trying to get away from. A lot of times that this is what this the poorer population do to cope. Some health promotion recommendations. Always going into situations like this with a non judgmental environment. We don't know how these people are feeling or what they face at home or what they face in their everyday lives. So, going into it with a non judgmental environment, giving them free space to confide in you and tell them, it's okay to express, things that may be embarrassing for you. Let them know that this is a non judgmental environment so they can open up so that we can help them. Expressing kindness, advocacy, and compassion for these patients is so important. Um, I'm sure that most of them talk to people or go to people who don't express those things to them. So just making them feel important and safe is our number one priority. Mental health screenings, this is very, very important in this population as they face so many trials and tribulations. It's important for us to focus on their mental health and do that screening so if they are a harm to themselves or others, we can get them the proper care. Recognizing when to bring in other healthcare teams such as social services, case management, or psychiatrists. This was something that I had to learn. I didn't know what situations would entail to bring in which healthcare team. So, researching this and talking to your charge nurse, your boss, whoever it might be that can help you is so important. Implications for new nurses. These are things that I have learned over the past year. Understanding that patients that we could be the only hope for them. Understanding this kind of gives you a better outlook. Going in knowing that, okay, we have the power to bring in other healthcare teams to help this patient. That kind of puts things into perspective of how important you are to this patient. Understanding signs, symptoms, and behaviors of abuse. It's one thing to see the signs and symptoms of physical abuse, bruises, scratch, scrapes, burns on the patient, but also noticing behaviors. How does this patient act with you just in the room? How does this patient act when their mom, dad, cousin, boyfriend, husband, uncle come into the room? How different do they act? Just noticing these signs can really, really help your patient and help you to know what questions to ask your patient. Developing empathy. This is something that that I experience just naturally, but I know for some people in talking with fellow nurses that this is something hard for them. Developing empathy for these people sometimes can be hard when in certain situations where you feel like, maybe they're just attention seeking or whatever it may be. That just goes back into coming in with it with a non-judgmental environment. Always treat these patients with empathy. You have no idea what these people are going through. Um, and also, empathy comes with thinking more of the patient's home life. Um, you know, we are most of us are very fortunate to have a good home life, and just thinking about these patients and what they go through at home really puts it in perspective and just gives you something to think about when you're talking with these people. Implications for veteran nurses. I actually asked some of my fellow veteran nurses to give me some things that they think about when they have a situation like this, and they most of them said to take it back to the basics. Assessing the patient, assessing for signs and symptoms of abuse, talking to the patient, asking those questions, reviving compassion. Sometimes when you've been in the nursing field a while and you have seen this many, many times, it is hard for you to be compassionate for these people. Reducing burnout by showing what a difference they can still make. When you are in the nursing field, we all know that nursing is hard and burnout is true and real. Um, Sometimes you just go through the motions and you feel like you're not really making a difference, but just taking a step back and knowing that you're making a difference can change your outlook and your mindset on things. Sparking a memory of a patient they helped with a similar situation. Just having one successful patient is all you need to have some hope that you can help this patient be successful also. Surprises. So the surprises that I noticed in this book is the mistreatment in medical facilities that are overlooked. It is crazy how things like this can happen within the medical facility, and sometimes it gets overlooked. How can this be eliminated? I was thinking 24/7 camera surveillance, but I also thought, would this hesitate nurses to work somewhere with 24/7 surveillance? In my opinion, it would make me want to work there because, what if a patient gets violent or a family member or anything, like you have that 24/7 surveillance to back you up. But other topics that I explored would be court-ordered mental health treatment. This is always something that I would wonder when I would have a patient who would have court-ordered to stay in the hospital for so many days. What indications do they have to have, and how long, and what is paid for insurance? What if the patient doesn't have insurance? These are all questions that I ask when I have a patient in this situation. And the patient also asks, what if I don't have insurance? How am I going to pay for this? So all of these things are surprises and questions that came up throughout reading this book. Impactful information. So, it is very disappointing to send your loved one to a facility and for them to come out even worse than what they went in with, due to the sexual abuse, assault, physical abuse, assault, verbal abuse, assault. When you send someone to a facility like this, you are expecting them not to go through these things. And it just makes you wonder if this happens today and what can we do to reduce the changes of things that happen in the medical facility. My mood throughout this book was constant questioning. I was sad, then angry, then empathetic, confused, heartbroken. But then at the end of the book, I took a step back and I knew that there was hope. There's hope that facilities don't do this today, that people will get justice if this does happen to them. And just, enforcing people to speak up is the main thing that I took back from this entire book. And here are my references. Thank you for listening to my book report over Good Kings, Bad Kings.